Hi, my name is Dr. Mitch, and there's a number of things that I talk to my patients about, and many of them deal with what they can do to stay out of my office, what they can do to stay in adjustment. And one of the main things that they can do is to sleep on a cervical pillow. Cervical pillow looks like this, has a contoured in the center. Their head goes over this so that their neck is supported. There are 3 reasons that I use this cervical pillow. 1, I get a headache if I don't. Number 2 is for stability, and 3, so the bones don't age. Now, when I think of stability, I think of how easily the bones move from side to side. This is a plastic model of the spine. This is the head, this is the atlas, this is the neck, and the shoulders start here. If you can see that this bone seems to move quite easily from back and forth. This hole right here is where the nerve comes out. If the bones move to the side like this, the nerves in that little area get pinched. Now, it looks like it moves easily from side to side, but it doesn't actually, because this is where the ribs and the neck is, and the ribs and everything connect here, so it doesn't really move that easily. This area and the neck up here, you can see how somebody has a straight neck. This is how they would look if they were on the cervical pillow. When they have a straight neck like this, I can take these 2 little bones and move them from side to side. That means it's unstable. If I put somebody on a cervical pillow like I showed you, and I say that's what their neck is supposed to look like, these bones don't move from side to side real easily. That makes them more stable. The 3rd reason that I use the pillow is so the bones don't age. This is a bone, this is a disc or a cushion in between the bone, and this is another bone. Do you see how my finger is over this disc space right here? If I straighten out the curve, which is what most people's curves look like on their films, it looks like this. You can visually see that my finger appears to be pinched. Most people would think that if bones get close to bone right here, that they would wear down. Actually, the reverse of that happens. If bones get close to bone and they start rubbing on each other, they make more bone. And that making of more bone is called osteoarthritis, degenerative joint disease, osteophytes, bone spurs. Has all kinds of ugly names that I don't want to have any part of, and I'm sure that you don't want in your neck. But let me make a funny statement, awkward statement, absurd statement. Osteoarthritis is a good arthritis. I want you to think about that for a minute. I'm making kind of a weird statement. Osteoarthritis is a good arthritis. Now, the reason that I say that, let's say that this bone right here in my leg is represented by my hand right here. And let's say for some reason, oops, I broke my bone in my leg. The broken pieces will rub together. When they do that, they produce some chemicals that tells the body, we have a broken bone. When those chemicals are produced, it makes more bone. That making of new bone to heal this broken bone is called osteoarthritis, degenerative joint disease. Has all those ugly names that I just mentioned. The point is, without osteoarthritis, I would not be able to heal a broken bone. It develops where bones aren't where they should be. Now, this picture on the wall, if you look at it, because somebody has a short leg, you can visually see that all of the bones in the picture aren't where they should be. That means that the short leg and the imbalance of the whole spine creates a situation where the chemicals are produced all throughout the whole body that are telling the body, hey, we have a broken bone. So if you have a gentleman who's, let's say, 40 years old, starts having knee troubles, he probably has those knee troubles because he's had a short leg his whole life. The chemicals inside the knee, because the bones aren't where they should be, have producing these chemicals that tells it wrongly it has a broken bone. So what it's doing is starting to produce arthritis in his knees. If he had even legs the whole time, he wouldn't have that arthritis in the knees. So if we can sleep on a pillow that has our neck in this position and not putting our neck in this position, then the osteoarthritis on the front here isn't going to develop. Another way that osteoarthritis develops is if the bones don't move. And that's kind of the basis of chiropractic. And I can almost say that the chiropractic adjustment is kind of like an anti-arthritic process. By getting in there and moving a bone that's stiff, you're telling it that you're not a broken bone. And what I mean by that, let's say that in my elbow here, let's say I put my elbow in a cast and I left it there for a year. And I took the cast off at the end of the year. You have to believe me that this elbow would never move again. Because the body was stationary in a cast for a year, the body thought it had a broken bone. So it fused the whole thing solid. But in a different hypothetical, let's say that I took that cast off this elbow once a week and I went like this, then I put the cast back on. I think you can understand that at the end of the year, I'll still be able to move that elbow. That movement right there is kind of like the chiropractic adjustment. Patients come in to see me and they're stiff. Well, if they're stiff, they're producing the same chemicals that tells the body you could have a broken bone. They have bones out of place. I put those in place. So it's almost like a twofold thing. The bone is out of place and it's stiff, telling the body it has a broken bone, producing these same chemicals. Now, the curve in the neck, if I look over here, this is a perfect cervical curve in somebody's neck. You can see the young lady's necklace, the back of her head, her bottom of her jaw is here, and her eyeballs would be out here. I've drawn a line through her curve. And this curve, this line is going right through the backs of each of these bones. And from what I just showed you about the pillow, if you can visualize this, this person would be sleeping on a cervical pillow because her neck would be being supported right here. Now, what happens is, inside this circle, because she has a good cervical curve, there are no chemicals being produced that's telling the body it has a broken bone. What I see a lot of times with people that come in here into the clinic is a neck that looks like this. You can see how straight up and down this guy's curve is. You can see his teeth out here also. But his neck is very straight. Inside the circle, I explained to you that the chemicals start to be produced that's telling the body it has a broken bone. And if this is untreated by a chiropractor, getting in there and loosening up, or a cervical pillow, it can start to look like this over time. You can see this young lady is still straight up and down. However, her space here is smaller than it is up here. This is a good space, this is a good space, this is a little smaller space, this is more smaller, and this is very small. Another thing that she has going is she has little points growing in the front here. You can see the point here and the point here. There are no points up here. There's a little bit of a point starting to grow right here. This is early arthritis. This is moderate arthritis, and this would be more of an advanced arthritis right in here. But in general, she has a long-standing degenerative process going on in her lower neck. If this is left untreated, or an extreme view of that would look something like this. You can see this older gentleman's neck is straight up and down. This is growing up to grab that one, and this was growing down to grab that one at all segments. I don't see this a lot, but it's the idea of what I see. This arthritic process, which we're watching here, can be slowed down. I can't really prevent it, I can't stop it, but I can slow the process down. And this x-ray proves that I can slow it down. But first, I want you to look at the picture and tell me what you think of the curve. I explained to you that the curve is supposed to follow a line like this. Yet this one has a good start to it, goes backwards and has a good start. So it's kind of a snaky looking appearance here. But in general, it's going backwards, and we'd like it to go like this. Now he has a good space here, a good space here, and no space here, and a good space here. Let's focus on this bone right here. This bone is square-shaped, and so is the one above it. This bone, however, is not. It's kind of wedge-shaped. This bone right here is the bone that I broke in my car accident. This is a 50-year-old who's been in a nasty car accident. This is a 36-year-old who's never been in a car accident. Comparing these two films, I like this neck better than this neck, just kind of for conversation purposes. This lady's, hers is getting smaller at 3 different levels. That tells me this is a long-standing degenerative process going on. This picture over here, I have a big space here. This is joined because it was supposed to, because it was actually a broken bone. But I have a decent space here and a decent space here. This tells me there's not a long-standing degenerative process going on. This young lady over here is pointed here, more here, and very pointed here. I almost don't have any points. That tells me that I don't have as much degeneration going on in the front than she does. I took this picture 26 years after this car accident. This should look much uglier, but it doesn't, because I sleep on a cervical pillow for over 20 years and I get my neck popped at least once every couple weeks to keep this young. I had a medical doctor, radiologist in here a couple years ago, and as soon as I put this picture up, he said a new injury. I just laughed at him and said, "Doc, you just made my whole point." I said, "This is 26 years post-injury." He couldn't believe it because he knows the degeneration that he sees quickly over in normal people. But it's because of the pillow that I sleep on and the fact that I get my neck popped quite frequently that I have kept this young. What I'd like to do is put the finishing touch on the little story I just showed you about the arthritis. This is a picture of a 14-year-old. And it's kind of shocking that she has no curve. As you can see how this space is a little bit smaller than that one. Granted that I'm getting a little picky, that's only a small difference there. But I predict with this young lady that if you don't use a cervical pillow and you don't get your neck adjusted, there will be some arthritis that will start to grow there. This is a picture of her 48-year-old mother. You can see that her neck is straight up and down also. You can also see that she's a rather larger woman than the small teenager. Weight has an effect on our bones. It'll make them older sooner. But the main thing I want you to see is inside the circle and the arrow that this space is almost gone at the same level that this young lady has it. And we've got all kinds of fuzzy arthritis growing there in the front. And she has a very, very stiff neck. Most people at this point say, well, this must be hereditary between the two of them. And I don't really buy that. The two of them sleep on two pillows. So they lie in bed with their neck supported like this. They also, in bed, read books like this, and they watch TV at the end of their bed. So they spend a lot of time at night just in this position. They are creating this to their neck. They learn that sleeping behavior from grandma who sleeps on three pillows. And I want you to focus in on what's growing in grandma's neck. She's very straight up and down here, and all of these segments are almost grown together. This is a very good reason to use a cervical pillow. And I just have to look at your film to see where you fit into this little timeline here. And I hope you keep using it and come back and buy another one in a year or so when it's worn out.